This is an event that is really going to demonstrate bringing a very capable, long-standing charitable organization in with their equipment and their supplies, and coupling that with our providers of health care in Manatee County. Let me share with you a little bit of the result that I'm getting already, and we really just got started in what we're trying to accomplish. Went to the Manatee County Medical Society Board, unanimously approved this, subsequently spoke with their president, Dr. Ramos, who said, you know, this is of great enough importance. We need to do this probably twice a year in Manatee County. Went to the dental board, got the same reception, and before I left their meeting, two of their dentists stepped up and said, you know, count me in. I want to be a part of that. Spoke subsequently with their incoming president, who says, you know, I'm going to bring 50 dentists to the event for you. Spoke with the president of the Florida Optical Association, who guarantees he's going to go throughout the state to bring optometrists to the table to be of help to us. Have not had a single meeting that didn't end up with complete cooperation. A few days ago, it went to my good friend, Dr. Angus Graham, because one of the things we need to do is mammography. Less than 5 minutes into our conversation, he says, I'll do it all, and it's free. Yeah. That amounts to about a $20,000 commitment from a single organization in our community. And I think it demonstrates unequivocally that the professionals in Manatee County will step up and do what's necessary for the needy in our community. As I said, when I went to this event in Tennessee the first time, I was very impressed with what Stan Brock had put together. I've been to 3 of those now, and in essence, this is a true humanitarian who has seen a need and has stepped forward in a very charitable way. And tonight he's with us when he's supposed to be in Weiss County, Virginia, because they're putting on a program that's probably going to serve about 3,000 people over this weekend. And in fact, his pilot told me that he just left to wait for him so that we could get him out of here and get him up to Weiss County. So without further ado, let me introduce the founder and the president of Remote Area Medical, Stan Brock.
First of all, I want to say that sometime a little more than a year ago, Glenn Givalina over here volunteered at one of our events near Chattanooga. And he came up to me after the event and he said, it'd be nice if we could take this operation to Florida. And he came back a couple more times, and then he brought along our friend Dick Kennard, and so here we are today. But Glenn, take a bow there. Thank you very much. And so it's wonderful to see all you folks here, because I know you all have an interest in healthcare in Florida. And so you might be interested to know how this sort of idea began. It seemed like a good idea at the time. The sixth man to walk on the moon, astronaut Ed Mitchell, I was having breakfast with him some time ago in Tucson, Arizona, and he said, well, how did all of this start? Well, I said, quite by accident, really. In fact, it was a kick in the horse from a wild horse named Kang, when I was a young teenage vaquero or cowboy on the Brazilian border in South America. And this horse Kang, which was a Wapishana Indian name, because by the way, all the cowboys were Indians except me. the word Kang meant the devil, and Kang had already killed two other vaqueros, and it looked like I was the next one on the list. So we lassoed Kang in the corral and threw him down and put on a blindfold, and then got him on his feet and tied him up to a post and put on the rudimentary saddle that all of us vaqueros had to make your own saddle out of various animal skins, and pulled off the blindfold and cut Kang loose, and he went bucking across the savannah and had a head-on collision with the side of the corral. And I was very badly injured. And the vaqueros came running over and they pulled me out from underneath the horse. And one of them said, well, the nearest doctor is 26 days on foot from here through that narrow trail in the rainforest where horses could not go. And when I told the six-man astronaut Ed Gilbert that story, he said, gosh, he said, I was on the moon and I was only 3 days from the nearest doctor. And so I said, well, you know, for people who lived in that neck of the woods where I grew up, and indeed some places here in the United States, they might as well be on the moon for the opportunity that they have to receive the care that they need. And so this was back, of course, in the 1950s, long time ago. And after several years went by, we used to drive huge herds of cattle several hundred miles from the Brazil border down to a place called Georgetown on the Atlantic coast. And this is a journey that took over a month. And that was after we had captured the cattle that we were going to take down the trail. And so years later, in the early 1960s, somebody suggested that maybe I ought to learn to fly, and so that would cut down on this travel schedule of 26 days on foot in an airplane. Well, I had never been any higher off the ground than the back of a horse, and but it seemed like a good idea. So we scratched out a bit of an airstrip there on what was called the Dadanauer Ranch, which covered some 4,000 square miles with about 50,000 head of wild longhorn cattle. So it was, in fact, the biggest ranch in the world. I thought that the airstrip looked adequate, and got on my horse and headed off to Georgetown, and took a course in learning to fly for 2 weeks. And after 2 weeks, perhaps somewhat misguided British colonial official gave me a license. And we bartered half a dozen head of steers for this fabric-covered airplane. And I remember loading a drum of fuel in the back and taking off from Georgetown and following the Essequibo River for a couple of 100 miles, and then turning south, followed the Rupununi River until we came out near the savannas. And finally, I was overhead the airstrip that we had made several weeks earlier. Came in for a landing, and as I was coming in, I could see that the Wapishana Indians were all sort of lining the airstrip, still holding their primitive tools that we had used, and I came in for a landing. Well, it was not one of my best, and I came on the brakes a little too heavily, and the airplane somersaulted over on its back in a pile of wreckage. And the Wapishanas came running over, and they helped me out of the airplane, and they were all full of smiles because they thought that this was the normal way of landing. Well, some years later, probably about 1968, I was brought up to this country for some reason, and brought to Chicago, of all places. I'd never been to the United States before, so after a couple of weeks in Chicago, You know, can you imagine the change from the northern tributary of the Amazon, the Takatu River, all the way to Chicago, Illinois? Because after I arrived there, a couple of weeks later, I remember making a donation to the Black Panthers, of 50 cents donation to the Black Panthers, because I thought it was to help preserve an endangered species. Well, in traveling around the United States, I found that there were indeed lots and lots of people like the Wapashanas who couldn't afford or didn't have access to health care. And so that brings us where we are here today. Scott Pelley said that we had done 500 and something expeditions. Well, that was about 8 years ago. We've done a few hundred more since then. We did one last week in Appalachia. That was number 771. And right now, as we speak, we're preparing in Wise County, Virginia, to see expedition number 772. And so we are leaving here shortly, I'm afraid, to fly up to Lonesome Pine, Virginia, so that we'll be in time tomorrow morning to let in 1,600 people. There will be far more than 1,600 people, but what we do, because of the huge numbers, is we give out 1,600 numbers. They're giving the numbers out there now, because people have been waiting there for a couple of days, camped in their pickup trucks and tents and so forth. And so tomorrow morning at 5 a.m., we will open the gate and I'll call out who's got number one. And but before I do that, I'll say, if you're here to see the dentist, please raise your hand. And all 1,600 numbers will raise their hand. Then I'll say, well, if you're here to see the eye doctor and you're hoping to get a pair of eyeglasses that we're going to make on the spot here with our mobile units, please raise your hand. And then 1,600 hands will go up again, because they're all there to see the eye doctor and the dentist. Then I'll say, now listen, folks, we've got a lot of really fine physicians here today. We've got women's health, we're doing pap smears, mammograms, we've got diabetic specialists and cardiologists. So who's here to see the medical doctors? And you can look out over that sea of people in the dark, 1,600 people out there, and maybe 3 or 4 hands will go up. The reality is they all need to see the medical doctor, but they're so preoccupied with the pain that they've been suffering from bad teeth, infected teeth, and that they can't function properly without a pair of glasses. And so we do try as hard as we can to persuade them to see the medical doctors, but it's the same all over the country, wherever we go. A couple of weeks ago, we were in California at the Anaheim Convention Center, saw a couple thousand people there. Same story. Everywhere we go, everybody wants to see the dentist. Everybody wants to see the eye doctor. And for some reason, the Affordable Care Act does not cover dentistry or vision care for adults. And so somebody needs to come to the conclusion that bad teeth cause not only a whole lot of suffering, but cause all kinds of other medical problems such as diabetes and heart disease and even death. And so we're really looking forward to coming down to Florida in November the 21st weekend. We've tried to come to Florida many, many times, but the greatest impediment to what we have delivering this kind of care here in the United States is that for some extraordinary reason, as many of you of course are aware, a doctor, a dentist, anybody with a license for the healing arts are not allowed to cross state lines to provide free care, I emphasize free care, for the poor and the underserved in another state. In Tennessee, we changed that law in 1997. And now it's been so successful that every time we hold an event like we did last week in Tennessee, 60% of all of the doctors and other providers that are there are from other states. Well, we've now got 12 states to adopt the same law that we have in Tennessee. Unfortunately, Florida is not one of them. Neither is Texas, where we'll be in 2 weeks' time. So there are 38 states that still do not allow people to cross state lines. And it's really a question of arithmetic. If you've got 1,000 people out there, you better have 100 dentists there with dental assistants to see all of those people. And the same thing applies to the eye doctors. And so it doesn't matter where it is in the United States, and we've been everywhere, it's really very, very difficult to get enough people licensed in that state to turn out without having other folks that are willing to come from another state to help out. And we get a lot of Florida practitioners that come up to Tennessee from Florida. And so now we want to bring some of those practitioners from Tennessee to reciprocate and come down to Florida. I can't tell you how proud I am of you folks here for coming together to make this thing possible. As I said to Dr. Kennard earlier today, we've done 770 something of these events, and we've never had a failure. Everyone has been a success. It's just a question of how many people, like on 60 Minutes, are we going to have to turn away because of not enough help to see them. And so I really, really look forward to coming back in November and working with you folks and seeing what a big success we're going to be able to make out of this operation here in Florida. Thank you very, very much. There we go.
I think Glenn's going to help take you to the airport. He needs to leave, unfortunately, because his plane is actually awaiting him to get up to Virginia. I think that gives you a good feel for where we are with what we're trying to accomplish. And there are actually three things that I need a lot of help with here. Number one, if you know people who need health care and basically cannot access that, please tell them about our event in November. We'll be getting a lot of flyers out and leaving those with various businesses, and we've tried to get the names of all of you here so that we can approach you to have some of those brochures available. Second thing that we do, we're breaking up the participation in two ways, sponsors and partners. And the partners are those who come to us with organizations and are willing to be advocates, willing to help us get sponsorship, willing to help us get volunteers to carry out our program. The other is to gain sponsorship, or those who will make donations to help us feed about 1,200 to 1,300 people 3 meals a day for a weekend, help us pay for some diesel fuel to get the people down here from Tennessee, and a few hotel rooms and that. So those are the three things that we need help with, and we'll be turning to the community. And as I said previously, I am so proud of the response that we're getting from every place we go to try to share with them what the needs are so that we can bring this very worthwhile program and initiative to Manatee County. Once again, I say thank you so much for coming out. John Saputo has been very great tonight. Says he's got all sorts of beer left out there that he's most delighted for you to share with, and I know there's a lot of food yet there. So once again, thank you, and there's no hurry for you to leave whatsoever. Thanks.
My name is Lori Dengler, and I am a volunteer with Remote Area Medicine. I am the chair of volunteer recruitment for the clinic that's going to be held in November. My responsibilities with RAM are to recruit the general volunteers to fill all the need for the clinic. That consists of about 145 volunteers each day that we hold a clinic. As well, I am assisting with medical recruitment, dental recruitment, and vision recruitment. You have a little bit of both. There are some people who've done mission work or just have a humanitarian heart, and the volunteers in that category are pretty easy to recruit. I have several friends that have done mission work inside and outside of the United States, so I'm calling on those people to recruit other volunteers. Some people aren't quite sure, but once they do a clinic, they'll be hooked in volunteering again.
And why is that?
Because it just is an awesome experience. It's very easy to volunteer with remote area medicine. You go to RAM, which is ramusa.org, and register as a volunteer.
And that's it.
That's it. You can also call me and I'll walk you through it, but ramusa.org and register as a volunteer. It's a very easy process. My responsibility is to recruit volunteers from the local communities. Bradenton, Sarasota, DeSoto, anybody in the surrounding area. Certainly RAM will bring volunteers to this local area as well. I just recently did a clinic in Cleveland, Tennessee, and already recruited volunteers that traveled from Florida to Cleveland actually to volunteer, and from other areas, and they're interested in coming to help with the clinic in Bradenton. Anybody that has an interest in volunteering, we can find a job for them to do. There's everything from handing out lunches to directing traffic to many non-patient care related tasks, entering data in the computer, just helping patients where to go. We certainly need translators with different languages. That's a very important role for the volunteers. And then medical volunteers as well. I'm actually a medical person myself. I'm a nurse practitioner for my profession. In this role, however, I'm working in a volunteer capacity, non-medical. That's word of mouth and contact, absolutely. Just talking to anybody we can talk to about the remote area mission and the work they do. And certainly we need every category of medical volunteer as well. Physicians, they have a dental clinic, so dental, medical, and also vision. To work at the clinic, a volunteer must be 18 years of age or older to work in the actual clinic where patients are. However, there's a great deal of work on the front end and on the back end with setup, with preparation of bagged lunches, with handing out information, with distributing flyers, just letting patients or potential patients know about the clinic. So on the front end and back end, outside of the actual clinic, you can be 14 years or older. The best way to volunteer is to go to the website, ramusa.org, which is ramusa.org, and click on volunteer.
My name is Linda Chrisman. I'm a physician, actually a pediatric ophthalmologist by training. I've been a healthcare executive for the past 10 years. So what I'm doing right now is I'm partially retired and a very happy volunteer with RAM to help them get vision services organized for the community event in November. That's a really interesting topic. I had the good fortune of meeting Dr. Connard at a meeting about 4 months ago, and he said, we're forming up this event and I want you to look at what they've been doing. And having grown up in the 60s, I had known the name Stan Brock immediately and was convinced if it didn't involve alligators and other reptiles, I was in. So I researched what they were doing. I remembered the 60 Minutes segment some years back, went back and reviewed that and said, absolutely, this is what we need to be doing for our community. It's a terrific mission, and I think what most people in the United States don't recognize, and most of our lawmakers don't recognize, is there are huge gaps in the services that people can access, especially for vision, because it's all well and good. If you've got a medical problem, you go to the doctor, you're probably going to manage to find somebody that will do something to help you. But vision is something that's only minimally covered by health insurance. Even Medicare and Medicaid, there's aspects that they do not cover. So even, for example, if you were older and you were on Medicare and you broke your glasses, you can't get a new pair of glasses for free. And my goodness, glasses are expensive. I won't tell you how much I spent on mine. But even minimally, you're going to spend $100 or more for a pair of glasses. So for someone who requires their glasses to drive, and you need glasses to drive here if you're going to get around, you can't drive yourself anymore if you don't have glasses. So all of a sudden you go from being sort of able to drive your car, care for yourself, to being a shut-in unless you can find someone to drive you. So it is hugely important for people of any age. And we just don't have that coverage in the United States. So the fact that they're coming in not only with people to make the diagnosis, but to help you select glasses and make the glasses on the spot, get you a medical referral if you have something like cataract or glaucoma, is a huge opportunity for the people in this community that they really have no way to address today. I think it can fill in the gaps and it can address the needs of people today. What I hope it also does as a doctor and a healthcare administrator is that it gets the attention of people nationally about what we're not doing today that we can do better. So in my dream world, sometime 5 to 10 years from now, we won't need to have these events anymore. Everybody will have the care they need. Well, I think one of the things that Dr. Conard has been very conscious of is this is not to supplant the medical community. This is to do it with the medical community. There's no way we can do this event without the doctors and other practitioners who work here. So we want them to own it as well. And then secondly, with regard to the people who come, I think it's going to have enormous impact. But I hope it raises consciousness. I think that those of us who are physicians, and I'll speak to my group first, is we're solicited all the time for everything. And most of the time your donations go to some nameless person somewhere in the world that you never have tangible evidence about. This is something that you can come and see and feel and touch and see your community grow and flourish. This is something where you can see a direct impact. So come out and help, give us some donations so we can have supplies, and we'll be back and the community will prosper.
My name is Brenda Ware. I am from Bradenton, Florida. I actually live in Parrish, Florida. I work at Manatee Technical College, and I got introduced to remote area medical through the college, who are going to be or not really sponsoring it, but we're going to be the facilitator for the event in November. I think the mission is fabulous. Stan Brock has done a wonderful job with the mission of this. The mission of this is we do not have as wealthy of a country as we are not caring for the people like we should care for. Therefore, what we're having here in Bradenton and other states as well is serving the indigent. We are finding so many people out there that need care in medical, that need care in vision, and need care in dental, and that are not able to get that because of people losing jobs, also people that cannot get insurance. I am in the dental department, and I will be working with the dentist as far as doing extractions, restorative work, and we will also be having hygienists doing cleanings. All right, I went to Cleveland, Tennessee this past weekend, and in Cleveland, Tennessee, I had the opportunity of working with the clinic, RAM Clinic, on Saturday and Sunday. It was probably the most rewarding experience that I have ever had in my life. The number of people that need care in any of our communities, no matter what state of it, is overwhelming. And I served on the dental community there and was working with an oral surgeon there in the area doing all extractions. We had a number of people. Statistically, I know we started out around 5 o'clock in the morning, and there were seats filled all day long for extractions, cleanings, and also for the restorative. A lot of people in Tennessee and the Cleveland area came from all over the area. We saw people from very indigent to people that could not afford care, to people that had no insurance, people that had been in pain for a long time that needed to be seen. I think that we owe our community a service of giving back as medical professionals. I feel that we have so many people that are out there that have fallen through the cracks in the medical profession that we actually need to be able to give back and give them the care. That says to me, as Stan Brock stated today at lunch, that we are a very wealthy country, that a lot of our people have fallen through the cracks. We need to give back to our people. To the both communities, to the medical or whatever it may be, nurses, doctors, dental, I feel that we know how much work needs to be done in the state of Florida, and that's where we're at now for the November Clinic, and I would hope that all of them would come out and would volunteer for these services. As far as the people that need the work, I would think and I would hope that they would want to come to the clinic in order to be treated. I don't think we will have a problem with that. There are so many people out there that need not only dental, that have no glasses, can't afford glasses. The people in Cleveland, from the first clinic I experienced there, I had people tell me they haven't even seen a medical doctor in 25 or 30 years, and they've been without glasses. They know they've needed glasses for 5 or 10 years and we're not able to get them or afford them. So I think people coming forward.
The mission is to help, and there is a segment of the population that is unable to access to medical care due to different reasons. One of the reasons is because they may not have insurance. The other reason is that their copays or deductibles are so high that they feel that they are uninsured and cannot access to medical care. So what I understand of this mission is that it will bring resources, human resources specialized in different areas, medical and dental, and will bring equipment in a scale that will be habilitating a big area to serve a significant amount of the population. I hope that hundreds may come and will be served. I think it's going to be a success. I personally will be involved in taking this message to the medical community in Manatee County and Sarasota County, both. And I think that the participation is going to be important. I always talk to my colleagues, and we're always thinking in ways to help this segment of the population that cannot access to care. And I think that many will be very happy to participate. Our citizens to access medical care through visits to the emergency rooms. And also not only that, but these are delayed medical care that could be prevented if the patient had a good access in a timely manner. So the need is significant, not only from the humanistic perspective, but from the financial perspective as well. I would like to invite the whole community, not only the medical community, to support this type of efforts. These efforts are only one intention, and is to help. There's no secondary gain, and we need to welcome this type of human beings that have devoted time and sacrificing resources to bring this, which is going to be of significant help to our community.